My name is Chilengi. I'm a professor of vaccinology and I'm a medical doctor in background. And presently, I serve as the health advisor to the president in Zambia. But I also double as the director general for the Zambia National Public Health Institute. So depending on what I'm dealing with, I wear one or the other hat. I'm here with, I think, on the call with colleagues that we've walked this path together over the last several weeks since WHO, World Health Assembly. And it was really a pleasure to participate in the meeting at WHO. I think meeting several different groups of people and understanding how they look at this issue of empowerment and sustainable financing. I think that since WHA, we had multiple conversations with colleagues and Joanne and her team and entertained several ideas of what is possible in terms of the theme of what we are looking at, and came up, I think, with a concept that we think is probably most practical and probably easily tangible with low-hanging fruits that we thought we would propose: the Women Economic Empowerment Zambia concept. Will you help me show the slides, Joanne?
Yes, I'll turn it over to my colleague, Francesca, who I know is working on that.
Absolutely. So if you give me a few minutes, I will pull that up. Please let me know if you can see my screen.
Yes, I can see your screen.
Can you put the slides in presenter mode, please? Right at the bottom, right there. Yep. Thank you.
Thanks, Alan.
Thank you so much. So we're here to really present the Women Economic Empowerment in Zambia concept, which we hope can briefly give you some high-level summary and then have a discussion around that. Next slide, please. So I think the case of empowering women at this forum need no further discussion. I think it is very important that we need to be targeting empowering women for very many reasons. But in Zambia, when we review the scanty literature available, we understand that just under 50% of the labor force is really estimated to be owned by women, and although this proportion seems higher relative to most African situations, the proportion of women accessing actual empowerment resources is actually much, much lower. Of the Zambian proportion, really up to 67% have really difficulties accessing that financing that may be available to support their either entrepreneurship or SME activities to move their business ideas and concepts forward. Next slide, please. So we think that there is a case in making sure that we address a really important public health gap in Zambia that can then be carved around giving opportunities to entrepreneurs to thrive, and in this case, women. One of those gaps in the public and clinical health space in Zambia is that of transportation. to health facilities, particularly in emergency situations. There are many situations, especially in rural Zambia, when there's need for transportation, and the lack of it results in huge problems. And that's because the ambulance system in many contexts is really very rudimentary or non-existent. And I think we have statistics of the leading causes of women death in childbirth related to emergency situations, which could be averted should there have been better sort of ambulance and transport systems that is functional, that is available when a given woman has a specific need. And therefore, we are actually proposing a concept that Zambia can consider, empowering women at the grassroots within the communities to be able to come up with sustainable ideas of how they can grow their business in terms of providing a service that meets a specific gap or a specific need in the health system that then results in a sustainable venture for themselves, but also serves an important gap within the health system. Next slide, please. So the backdrop to this conversation is that Zambia as a country is really committed to the decentralization of health services. What has happened since the new government came on board last year is that the devolution agenda has been taken forward, not just in ways of discussion, but really from the national budget, which is really equally distributed among constituencies and sent to the constituency. And for the first time ever, rural as in urban communities will have access to these constituency development funds equally across the government, across the country. Now, following that is really the decision to decentralize health services and many other services. In the case of health services, we are coming from a situation where health service delivery was centrally managed at the headquarters of the Ministry of Health. But with this decentralization policy, we are actually moving the agenda where the primary care system will be devolved down to the district level and the community level, so that the local authorities at that level, working with their communities, are able to basically provide solutions to problems that they need. Firstly, in fact, identify what challenges and problems they are having, budget for those themselves, and be able to deal with those problems in and of themselves. And I think the table below just summarizes some of the statistics on available information on the approaches that the decentralization policy is taking. Just as late as last month, we had actually over 50,000 civil servants who were previously in the Ministry of Health, Ministry of Community, Ministry of Agriculture, moved officially to the Ministry of Local Government and Rural Development, essentially driving the agenda of decentralization. And I think within that concept of decentralization, empowering local communities to be able to make decisions, to come up with solutions and enterprises, lies the opportunity of this women economic empowerment program that we are proposing here. Next slide, please. So the government is committed to the decentralization policy, and basically what we are saying is that the decentralization policy is happening and is aimed at enriching accountability and transparency among local authorities. But most importantly, really, it is about empowering the local. And I think that the concept and the spirit of this particular concept is very much seeking to to strengthen financing, institutional performance, and accountability of rural local authorities within Zambia. But in this case, empowering local women groups that they may embark on an enterprise that addresses a real need, and that also creates sustainability because it operates in a profitable and sustainable manner. Next slide.
And Professor Roma, I just want to emphasize what you said, that sustainability and that, profitability that, you are discussing. So we're moving both from, the technical assistance side of the project. So some things will always need technical assistance, but some things will need equity capital. And that's why, I think that the example in this case study is perfectly fitted for, the fund that is being created because it has that technical assistance part to it, but it also has that equity, just to kind of emphasize what you just said. Over to you.
Right. So I think in our case, we think that it is feasible to identify groups of women who may be professional in terms of the health system. This may be groups of women who will be entrepreneurs, including nurses, drivers, and basically groups that can be trained and equipped to run their own business and empowered with capital investment, for example, in transport terms, to run an ambulance service for a given community. Now, because this will be community-based, they will be known within the community. So everybody within the community would be able to understand that when you need an ambulance service, here is where you go. And there is a conversation we are having around the National Health Insurance Scheme, which we are exploring because there is recoverable cost within that mechanism for ambulance and transportation services. So if women can be empowered to be able to manage an enterprise that provides that service, for example, among themselves have capacity to identify the health challenges within the community, identify which patients would need to be transported quickly to the health facility, and within themselves be able to have a mechanism where you could actually have women drivers of these ambulance services that can then be able to pick up the patients, take them to the health facility, make sure within the health facility they receive appropriate treatment and attention that goes to serve a specific need within the community. But most importantly, the women then become a very valuable component of that society, meeting a very specific need. And I think this concept can be broadened to other aspects that can include basically how you manage communication among the community and among the women themselves. And you could extend it to how you provide very basic medication or treatments. And within that concept, you could have women who are actually providing basic pharmaceutical supplies needs, such as dispensaries within the community. Because often another gap is that a patient in need will go to the facility and they will have no medication, and they will write a prescription. And sometimes for that prescription for the commodities written on the prescription to be procured, it is not so easy. Sometimes in rural areas, it's not even available. So therein lies another concept where you can have women groups that are running a facility that serves a specific need when a patient does need to procure or acquire particular medication. So we think that if women are specifically trained and targeted to provide this kind of service, and most importantly, empowered, equipped with the basic capital resource they need, provided the technical training and support they need, including some hand-holding in mentorship and other schemes, this is something that can actually function to serve a greater gap and can be sustainable, but I think most importantly, make these women relevant and valuable members of society in which they live and serve. And lastly, create employment among themselves and solve a greater goal of the economic empowerment that we are talking about. I think this is my last slide.